Shoulder pain. You know that feeling, right? It can start as this kind of dull ache, and then bam, it's a sharp, super frustrating barrier to just living your life. It's incredibly common, but honestly, our ideas about how to fix it are often a little bit hazy. So let's dive in and clear things up. We're going to use a fantastic narrative review from the journal Curious to be our guide here. First off, let's just get a sense of the scale we're talking about. The research shows that the lifetime prevalence of shoulder pain is nearly 70%. Wow. That means most of us, at some point, are going to have to deal with this. This isn't some niche issue. It's a shared human experience that can mess with your sleep, your work, and pretty much everything in between. So when that ache or that little twinge starts up, what's your first instinct? To rest it? Maybe frantically call a specialist? Well, it turns out the evidence points to a strategy that's way more active and honestly more empowering than you might think. And it really challenges some of the biggest assumptions we have about recovery. Yeah, whether you're dealing with rotator cuff pain, a frozen shoulder, or just some general soreness, these problems are a huge cause of disability and a top reason people go looking for medical care. But the modern game plan for fixing it, well, it starts in a place you might not expect. And there it is. Seriously, this is the single most important takeaway. For the vast, vast majority of shoulder problems that aren't from a big, sudden injury, the first and best thing to do is non-operative care. Surgery? That's way down the line. It's really reserved for very specific cases or when a really good conservative plan just hasn't worked. So what does this non-operative care actually look like? Well, it all begins with building a super strong foundation. I want you to think of recovery not as a single fix, but like you're building a house from the ground up. And the most critical, load-bearing part of that whole structure, it's something you are in complete control of. The source material could not be any clearer on this. Exercise is the bedrock. It's the cornerstone of effective treatment. It doesn't really matter what the specific diagnosis is. A structured, active rehab program is always going to be the central pillar. In fact, for really common issues like subacromial pain, that's that pain on the top and outer side of your shoulder, studies show a good exercise program can get you results that are just as good as surgery. That's huge. Okay, so what does exercise-based care really mean? It's basically a three-part playbook. First up is education, just understanding what's going on inside your shoulder. Second is activity modification, and this is key. It means temporarily backing off the specific movements that cause pain, not stopping all movement. And third, the heart of it all, a progressive strengthening program that goes after the rotator cuff and all those crucial muscles that control your shoulder blade. Now look, building that foundation of strength takes time, right? It takes effort, and if you're in a lot of pain, it can feel almost impossible to even start. That's where the next layer of treatment comes in. Now, these aren't cures, but think of them as incredibly useful tools to help you get the real work done. This is such a crucial point to get. Things like anti-inflammatory meds or even injections, they're not designed to magically fix the root problem. Their main job is to give you a window of opportunity, a window of relief. They dial down the pain and inflammation just enough so that you can actually do that all-important exercise program. They help you do the work that creates lasting change. So let's peek into the toolkit. You've got corticosteroid shots, which can give you some powerful pain relief for weeks, maybe even a few months, buying you critical time to build strength. For a frozen shoulder, there's a procedure called hydrodilatation, which is used to physically stretch out that tight joint capsule. And then there's PRP, or platelet-rich plasma. It's still an evolving treatment, but the goal is to support the body's own healing process over the medium term. See? Each tool has a very specific job to do. All right, so how does all of this come together into a real-world plan? Let's take a look at two of the most common shoulder complaints out there. You'll see how that foundational principle, exercise, gets customized depending on what exactly you're facing. Check out this contrast. It's so important. If you've got rotator cuff pain, the focus is all about building capacity and strength in the muscles that support and move that shoulder. But if you have what's called adhesive capsulitis, frozen shoulder, the main goal is totally different. It's all about mobilization, about consistent stretching to get back that lost range of motion. Same principle, active recovery, but the application is tailored precisely to the problem at hand. So when you pull all of this evidence together, a really clear picture starts to form. The most effective way to recover from shoulder pain isn't a passive journey where you're just waiting for some procedure to fix you. No, it's an active one, where you become the main person in charge of your own healing. All right, let's wrap this up. Here are the key takeaways. First, conservative, non-operative care is the gold standard. It's where you start. Second, exercise isn't just a nice to have, it is the main event.
Third, injections and meds, they're valuable supporting actors that make it possible for you to take on that starring role in your own rehab. And finally, that exercise program has to be the right one for you, tailored to your specific situation. And that leaves us with a final thought to chew on. What if we just shifted our whole perspective? Instead of seeing shoulder pain as just this setback, this thing to be passively fixed, what if we saw it as a signal? A signal that it's time to actively invest in our bodies, to build resilience, and to come out of the whole experience not just healed, but fundamentally stronger than we were before.